What else? We will have, we will be going on for 2 hours. We will have a 10-minute break in between. We have sign language interpreters with us, and we have the captioning as well. And I think this is about it. So without further ado, I will hand over to my colleague, our co-chair, Jamie Bowling, who will say a couple of welcome opening words. Jamie, over to you.
Thank you, Ines. It's exciting to be part of this launch, the first independent living survey for ENIL. I'm also thinking the 10th of December, isn't it Human Rights Day? Or maybe I'm mixing things up. But it's fantastic to be here and glad to see so many people joining us. From the end of June to September, the data was collected where we launched the independent living survey. The aim was to collect general information about the access to independent living of disabled people across Europe, with detailed information about personal assistance schemes and systems. This is important for we disabled people, as independent living is essential for us to live lives of full participation. Having information is an experience exchange so that we can also see how we can better advocate for better rights in each of our countries. It's also important when assessing the impact of COVID, understanding disabled people's perspectives on independent living, the upcoming European Disability Strategy. All of these should address the barriers faced by disabled people, which will be brought forth in this survey. The online survey targeted countries from the Council of Europe area and was disseminated to ENIL members, but also general public. The survey followed personal assistant tables, which were published in ENIL 2013-2015. The questions were based on ENIL's personal assistance checklist, which was published in 2019. A total of 143 responses were received, 116 in English, 7 in French, 20 in German. The majority came from disabled people, including personal assistant users and organizations of persons with disabilities. In the end, there's 43 countries which were included in the analysis. A detailed description of personal system scheme and policy in the form of country sheets is available for 30 countries. The only countries not included in the survey are the Russian Federation, Andorra, Liechtenstein, Monaco, and Switzerland. The work on the independent living survey was carried out by ENIL with financial support of ULOBA, Steel, and Gill, members of ENIL, as well as the European Solidarity Corps program. And we'd like to thank ESC volunteer Nina Hortolan for all the efforts and commitment to this work. There is some parts which will be published at the end of January, but I know that Nina will talk about this and give some highlights on that area. And with that, I will introduce the MEP Katrin Lange-Sipen. Sorry for my pronunciation. Thank you very much, and enjoy the launch. Thank you.
Go ahead, please, Ms. Lange-Sipen. Yes.
Yes.
It should work now.
Thank you. Thank you for inviting me. And thank you for the very important work you are doing, for your fight for independent living for persons with disabilities in the European Union, and also for the survey on access to independent living that you are going to present today. We all know that there's a huge lack of official disability statistics and data. And there's an almost entire lack of data on persons with disabilities living in institutional care settings. Independent living is a human right. This is clearly stated in the UN Convention on the Rights of Persons with Disabilities. Even 10 years after the ratification of the convention by the EU and its member states, this human right is still violated. The pandemic has shown us the deadly consequences of institutional living, but it has also shown us the problem of the lack and of the underfunding of care and assistance services. Carers were left alone and did not get enough equipment and tests to protect themselves, so that many persons with disabilities didn't get access to essential services. On my initiative, the European Parliament adopted a resolution on the new EU disability strategy that clearly demands actively promotes the transition from institutional and segregating care to community-based support, including personal assistance and inclusive services in all the relevant EU policy tools and initiatives, and that this transition is included as an indicator in the EU's social scoreboard. We need to stop funding segregated living. We need accessible housing in our cities and in our rural areas. We need inclusive mainstream programs, and we need sustainable funding for tailor-made personal assistance and community-based services. We also urgently need to harmonize the definition of disability and introduce a real EU disability card in order to guarantee the freedom of movement and the relevant services for persons with disabilities throughout the EU. In that sense, we all hope that the Commission will come up with a strong EU disability strategy next year that clearly stands for independent living and against institutions. What is for sure is that we will continue fighting for it together, from MBC side and with you as NGO, and nothing about us without us. Thank you.
Thank you very much, MEP Langensiepen, and thank you for joining us today, but thank you also for all your support and your leadership on independent living, on the right to independent living in the European Parliament. Before we move along to the presentation of the results of the Independent Living Survey, I would just like to take you briefly through the agenda today. So we've just heard, obviously, the welcome and opening remarks. We will move to the main findings of the survey, which will be presented by my colleagues Frank, Sean, and Nina Portalan, whom Jamie mentioned already. We will then have a brief panel discussion with our colleagues from 4 countries, from Croatia, Finland, Georgia, and Portugal, whom I will introduce as we get there. As I said, we will have a short break after that, during which we will play a couple of videos for those who are interested. And then we will continue with the reactions to the survey from the European Commission, European Parliament, and the Fundamental Rights Agency. And we are very happy to have colleagues from these institutions with us. So thank you very much for joining us. Again, I will introduce them later. We will hopefully have some time for questions and answers, and we will finish with some brief concluding words from our other co-chair, Nadia Haddad. So now, without further ado, let me give the word to Frank, who will tell you what we found out during the survey. Frank, over to you.
Thank you, Ines, for the introduction and the agenda as well. So let me indeed go through what me and Nina will present to you today. So first I will speak a bit about the methodology of the survey, and then highlight some general trends, of which you also find most in the report. And then Nina will go through the sections on the section 2 of PA and already give you a sneak peek of what is not yet published but will be published later on the PA fact sheets. And then we will end with some recommendations. So let me now go first to the methodology and indicate some strengths and some challenges we faced. So as Ines mentioned, we no, as Jamie mentioned, actually, we had the responses were from disabled people and PA users all over the Council of Europe countries, and we actively involved ENIL member DPOs. So this was really a strength because it really, you know, showed the perspective of disabled people and their view of how the systems work in their country. Now, this also was linked to a challenge that we faced, that because we asked people to give their opinion on a system, obviously this led to some subjective views and responses. We tried to counter this by making sure that we had multiple responses from each country, and we also checked with our member DPOs if the responses were accurate. But it's still something that we faced. Another challenge that came up was a misunderstanding of the concept of personal assistance. This was the case both on the government level, so that governments wanted to set up a PA system, but actually did not provide sufficient funding, and even sometimes with the disabled people also misinterpreting the term. And then a final challenge that is worth highlighting, and you can also find more about it in the report, is regional differences. So we saw that across countries, basically, it heavily depends on where a person lived in a country. So if it was a region with good coverage or bad coverage, with good funding or bad funding, in some countries we could pinpoint this due to regional differences in law. In other countries, this was less clear, but we tried to accommodate this. So with this methodology out of the way, let's now go to trends. And as a first general trend, I might surprise you and not go straight to the UN Convention on the Rights of People with Disability, but actually to other things, which is services. And why do I start with services? Because we also have on the European level, and the MEPs and the members of the Commission here present will notice, we have the European Pillar of Social Rights, and recently also a proposal for an action plan to implement this pillar. And the pillar is basically a set of aims and objectives that the member states have set themselves in terms of access to services. Now, when we ask in our survey about the access to mainstream services, we see that it is rather poor in terms of accessibility. You see here on the slide, for instance, culture, public transport, healthcare, housing, education, and employment. When we look at employment, for instance, and also MEP Langens even did the report on this, we see that not a single respondent said that employment is adequately accessible to them. So this is really telling that it's still a lot of work to be done. And also in housing, we see that most people rate access to housing as inadequate. So moving on, this leads us to a second trend, which can be seen in the question: can all disabled adults decide where and how and with whom to live? And we see here on the slide that 60% of the respondents said no, and 40% said to some extent. Well, while this is telling two things. Well, first of all, nobody said that they could, so nobody said yes, which is already telling a lot. But also, 60% said no, so totally not, and 40% said to some extent, which means that this right or this option is available to some disabled people, but not to all. And taking these two trends together, I think this brings us to the UN CRPD and Article 19. And so we asked about this as well. How would you describe the implementation of Article 19 in your country? And 72% of people said that it required, no, that it was inadequate, and 28% said it required improvement. So here again, it is very telling that, well, not a single respondent said that it was adequate. However, rather than only only looking at the issues, the problems, we also try to look at some tools to advance the implementation of independent living and the CRPD in the countries. So now let's have a look at this. Um, the first kind of tool that you can use to advance independent living is a DI strategy. So we asked, does your country have a DI strategy? And we see that 42% of the respondents said yes, while 56% said no, and 2% said, I am not sure. So this corresponds to 18 countries saying that there was a DI strategy, and out of these 18 countries, 13 countries were EU countries. So even after the Brexit, this is still less than half of the EU countries that have a DI strategy. So this is something also that we need to take into account, that also in Europe there is still a lot of work to be done. And when we look more to the EU perspective here, we can see that when we ask the questions, are you aware of European funds still being used to invest or renovate institutions? We saw that 51% of respondents said yes, 33% said no, and 16% said I am not sure. Now, this is also a very telling statistic, because this means that, well, in terms of countries, 22 countries said that they were aware that European funds are still being used to build or renovate institutions. These were not only EU countries, but also countries outside the EU, like Turkey and North Macedonia. So this shows that even though we have legislation, the implementation needs to be better to, in practice, avoid investment in institutions, because still, many disabled people see the EU as part of the problem of building new institutions rather than as being part of the solution. So both in the EU and in external action, there needs to be more forceful action and monitoring to ensure that there is no investment in institutions. Um, Now, let's go to the final trend, which is personal assistance, that I will highlight here. And this is probably the most positive trend, because here we see that 77% of respondents answered to the question, can disabled people access personal assistance? 77% answered yes, 14% answered no, but there is a plan, and 9% answered no. So this means that in the vast majority of the countries, people can access PA, or there is a plan to access PA. This was the case in 39 of the countries under research. Does that mean that everything is perfect? Um, no, because also when we asked the question, would you describe access to personal assistance in your country as adequate, inadequate, or requiring improvement? 52% said requiring improvement, 45% said inadequate, and only 3% said adequate. So this means that 97% of the respondents found that there was something to be improved about the PA system. And the main blocks here were inadequate funding, also regional differences in legislation, and not so great assessment. And with this, also Nina will tell you now more about this. Just one disclaimer before I hand over to Nina is that the information that will be presented here is the information reported to ENIL. We did not cross-check all of it, so there might be inaccuracies. However, we did try to highlight trends across countries that we saw coming back over and over again. So Nina, with this, over to you.
Thank you very much, Frank, for the general overview and introduction. As you said, now I can take us further into the PA section of the survey and the segments it had, with some examples of trends we noticed there and through some countries where I can highlight that. First, we go through general information and corresponding legislation. In this segment, as an example, I will use France. One of the things I want to highlight here is unequal implementation of the legislation across country, and therefore fragmented access. The provision of personal assistance in France is recognized as a right, and the scheme is available on local and national level and codified in a national law. However, this legislation is inadequately applied. Therefore, the right to PA in practice depends on the region and is accessed very unevenly. There are also restrictions on what personal assistance can be used for, reflected in predefined lists of tasks that assistants can perform, and these lists can also vary across the country. Finally, those living in residential care settings do not have access to the scheme and do not have possibility to apply, as do neither do 50% of our responses to the survey in general. And of course, in some countries where there is access, we see that there is a lack of adequate support, information, or their requests to access personal assistance are often denied, such as in Bulgaria, Portugal, Belgium, Norway, Germany, and Iceland. It is important to know here that when we say use of personal assistance and access to personal assistance in residential care settings, we do not mean that it is right to allow people access to personal assistance without the actual possibility to leave these residential care settings, but PA should be used as a tool to allow them to live independently in the community. Secondly, we can move on to funding, and here as a good example, we use Sweden, which has a system that is generally considered as very good, but we see that also this system is encountering some difficulties in recent years. Personal assistance is paid through direct payments such as personal budgets, and the funding allows users to employ assistants from the open labor market. However, it does not allow them to hire any services which are not directly related to personal care. The scheme is also not limited by a cost ceiling per user, and it covers a wide variety of additional costs, such as employment costs for assistants, the cost of training, specialized training if it's needed, improving the working conditions of assistants, tickets for events, travel, accommodation, and food. Research has been carried out into these costs of PA, and family members are allowed to be paid as assistants. However, using personal assistance restricts the user's eligibility for other support and services, and in general, the PA budget is often not sufficient to cover the user's needs in practice, as is the case in general in 85% of our responses. When we move on to eligibility and needs assessment procedures, and here I will use the example of the Republic of North Macedonia, we see that these assessments are often very medicalized, and eligibility is often limited to a very narrow section of people with disabilities. The Macedonian law on social protection defines disabled people of working age as those 26 to 64 years of age, and only those of them with physical or sensory impairments are eligible for personal assistance. The assessment is conducted in a form of a structured questionnaire using lists, and there is no possibility of adding additional activities or services to this list. There is also no access to adequate information or peer support before or during the assessment. The assessors do not receive any training on independent living philosophy or the social model of disability. The outcome of the assessment is expressed in hours, but we see that there is a very low limit of maximum 80 hours per month. Finally, a disabled person can file a complaint against this outcome, but it is unclear if this leads to a general appeal procedure. Moving on to general trends in regards to eligibility and needs assessment procedures. In 61% of our responses, it is also stated that eligibility and needs assessments are led by professionals, usually medical professionals such as doctors and psychologists. Also, in the majority of our responses, the assessments are deemed to not be transparent. Only in Finland and Austria, the majority of respondents said that both assessments are user-led. We also see often that persons with intellectual impairment, as those with psychosocial disabilities, are often not eligible. And when persons with intellectual impairments are eligible, they can very rarely manage their own assistants. Usually, they're not allowed to do this. Moving on to characteristics of personal assistance provision and recruitment of assistants, I can tell you more about some general good practices we notice and common barriers. The good practices are the cases where users can freely select and hire their assistants, where, as previously mentioned, persons with intellectual impairments can independently manage their assistants, or where supported decision making is available to do this, and so is peer support. However, we also encountered some common barriers across our responses to the survey. In many countries, users cannot choose who provides their personal assistance, or if they do have a choice, they are not informed enough of their choice of providers. The number of personal assistants a person can employ is also dependent on funding, which is often insufficient. And finally, users are often not provided with training how to manage their PA. The final common danger we see is that personal assistance is very often mixed with care services. It excludes very big groups of disabled people and limits their access to other services. Lastly, we can move on to working conditions of assistance, and here I will use Norway as one of our examples. In Norway, the assistants work fixed hours and days. However, the users have the possibility to transfer assistance hours as needed. The provision of assistance is also not bound to a particular setting, therefore users can decide where and how they want to access assistance. Assistants do receive training on providing assistance, which is provided by other users or the local authority, and this training is mandatory. No specific qualifications are necessary for people to work as personal assistants, as is the case with 75% of our responses in general. The wages of personal assistants are protected by minimum wage regulations and competitive when compared to those of similar occupations in Norway. It is also recognized as a profession there, as well as in Belgium, Serbia, Croatia, Slovenia, Sweden, and Iceland. Personal assistants are also entitled to benefits such as social security and paid leave. However, we see the general reality is that the wages of personal assistants are very low, which limits the availability of assistance, therefore having a big impact on family members, which often act as informal assistants. And with this, I can take it back to Frank, who will give some final recommendations how we can improve this system. Thank you.
Thank you, Dina. And with this, I will have the final recommendations to give before we hand over to the testimonies. And here you can see them on the screen. So we have three main recommendations. The first one is that countries should adopt comprehensive and binding deinstitutionalization strategies with the active involvement of disabled people. So these strategies should also, link to all areas of life, like the services we saw at the beginning, like you have education, transport, employment, etc., and include also a complete closure and a ban of investing in segregating settings and also renovation of the specialized and segregated settings. Then the second recommendation is that when you are putting in place a PA system, this should again be done together with the active involvement of disabled people, but also be properly funded and recognized as a right. So PA should not be for the few or for a select group, but for everybody, so a wide catchment. And also access to PA should not exclude access to other services. One general recommendation we can give also here is that you have the general comment number 5 in the CRPD, so basically use the guidance that is given there. And then the final recommendation is more towards the European Union, as also the EU can do very much more than it is currently doing, or more forcefully do this by setting clear European targets and also ensure monitoring. And this can be done within EU competences. As was said also by MEP Langen-Sieben at the beginning, we have the scoreboard in the pillar, which can actually be used to monitor member states' progress towards DI and towards putting in place community-based services and personal assistance. The European Disability Strategy also can make clear that all investments in all European funding mechanisms should not go to institutions, so there should be a complete ban across the board. And the European Disability Strategy could also include, for instance, communication on the development of community-based services and the necessity of that. So basically stimulating the debate and really pushing the member state instead of being afraid of going into this debate with the member states. And so these are the recommendations. And then all that is left for us to say is that we have the summary report and the country sheets uploaded on the website, and we will continue to upload more until January. If you have any questions or you want to give us more information, please feel free to contact us. The slides will be shared also after, so you will find the contact information there. So with that, back to you, Ines, and thank you for listening.
Thank you so much to Frank and Nina for this presentation. As you heard, this is really very rich data on personal assistance especially, and very helpful, at least in our view, in terms of helping countries which want to improve their PA systems in terms of learning from countries where it works better. But also it's very good to have this so we can identify some common problems at the European level and try to, come up with joint actions, joint solutions. So we are very thankful to everyone who contributed to the survey, but we are also thankful to our colleagues, to Nina and also Frank, for going through all of this data. As Frank said, and the link has been shared in the chat box, the summary report is uploaded, but the second part of the summary will be also finalized in January, because it will look at comparatively at the PA schemes. We have already uploaded some country sheets, and we will continue uploading them, as Frank said, and we are hoping to have all of them there until the end of January. So we will move on now, but if you have any questions in relation to the survey or to any particular PA schemes, please use the chat or the Q&A, and we can try to respond to them during the discussion. Now we have invited a couple of people who responded to the survey to reflect a little bit on the situation in their countries. Unfortunately, it seems that Marica from Croatia did not join us, so but we still have 3 countries, which is great. So we will start with Sani Purhonen from Finland. So Sani, please switch on your video. And I will ask Sani, and indeed all of the panelists here, what do you consider to be the main challenges, the main problems in the personal assistance system in your country, and what would it take for it to better support the right to independent living and to be more in line with the convention? So Sani, over to you.
Okay, can you see me and hear me?
Yes, we can.
Okay, good. So in regards to personal assistance in Finland, there has been a lot of discussion, for example, concerning so-called resource restrictions. So who is capable of acting as an employer of a personal assistant, or capable of defining for themselves what they need assistance for, or what kind of assistance they need. And this question obviously concerns, for example, people with intellectual disabilities, among many other groups. But it also manifests so that currently all the people with disabilities cannot in practice have personal assistance or enough personal assistance hours, because there is also inequality on how many hours of personal assistance a person can get, depending on the municipality they live in many cases. And even the municipalities don't even know legislation in some cases, and hours that are granted are inadequate. In some regions, people are forced to live in housing units, or in the situations when they are not getting enough hours of assistance there, and also they don't get enough assistance inside the units either. So in practice, they are living in a situation where they cannot keep they cannot get enough of personal assistance. So the form of housing in practice puts the recipients of personal assistance in unequal positions. So there definitely should be change to make sure everyone can get enough personal assistance regardless of where they live, or regardless of regional differences or municipality differences, or who is making the decision about the hours. So process of deinstitutionalization in Finland is not being implemented effectively, even though the strategy for it has been adopted for 10 years ago. So we should definitely do more work in regards to that to ensure that disabled people have a genuine choice to decide where they live and who they live with, and also not to let the form of their housing to put them in unequal positions with regards to personal assistance or living in general. So those were just some of the findings we had. There is a lot of good legislation, but it's not necessarily being implemented well, or there can be as we noticed earlier, there can be a lot of differences depending on municipalities, for example, which should not be the case, obviously.
Thank you so much, Sanni. And I forgot to say, Sanni is from the Threshold Association in Finland,
Yes.
A member of ENILs. Thank you so much for that. I think you've touched on some points which in fact have been common across the countries. And that is mainly of really unequal access, of the legislation not being adequately implemented, of the fact that there is a disconnect between the process of deinstitutionalization and access to personal assistance, in that people who are living in institutions cannot use personal assistance to move out of institutions, etc. So thank you very much for that. And perhaps we will come back to you if there's any specific questions. For now, I will hand over to Simone Petridisi. He's an activist, but also an advisor to the president in Georgia. And Simone, it's the same question for you, if you can reflect a bit on the system of personal assistance in Georgia, which is fairly new as far as I understand. The floor is yours, please.
Thank you. It's my pleasure to welcome all participants today. My name is Simon. In the next 5 minutes of my speech for conference, I'll speak about the institutionalization strategy, access to mainstream services, and personal assistance. The development of new social services is important for people with disabilities. These services should be based on their needs and best standards. We need to start work on the creation and development of centers for independent living in the regions of our country. This will help develop the personal assistant services throughout the country. The country does not have a modern institutionalization strategy, but progress made in the last 5 years of this issue. Starting next year, it is planned to create a working group in this direction, which will include public organizations and decision-making bodies. In Georgia, the creation of an agency responsible for the implementation of the Convention on the Rights of Persons with Disabilities is starting, and we think that we will in this direction. Access to personal assistance in Georgia in general requires improvements. The scheme is delivered as a pilot project which started on 1st January. It's available at local level and is codified in a separate national law. In rural or remote area have access to the scheme depends on the region, while those living in residential care settings do not have access. These are restrictions on what personal assistance can be used for, which is reflected in a pre-defined list of tasks assistance can perform. This is a way to access personal assistance in the country, but the number of personal assistance users has increased in the last 5 years. There have also been positive changes in regard to the legislation policies that affect access to PA in the same time period. In Georgia, the assistants work fixed hours and days. The users also have a fixed number of pay hours per day or week. The provisions of assistance is bound to a setting, so PA can only be provided, for example, at home, school, or work. The users do not need to account for their use of assistance. Contingency arrangements, if assistance became unavailable, are also available. Personal assistance is not recognized as a profession, and no specific qualifications are necessary for people to work as PAs. Personal assistant can receive training on providing assistance if it is paid for by the users. The training is provided by NGOs and it is not mandatory. The wages of personal assistants are low, so family members often uh, informally work as PAs. This was a brief overview of the situation in my country as an advisor to the President of Georgia on disability issues. Thank you for organizing this meeting. We are ready to deepen cooperation with you, and we think that together we will achieve optimal results.
Thank you. Thank you very much for that, Simone. Thank you for being here. As ENIL, we are also very happy to see personal assistance being available, not just across the European Union, but across Europe as such. So we're also very happy to work together. We have, Marica has managed to join us now, so we do have two more country reactions. If it's okay with you, I would go on with them and then we will take our break. So I will now pass over to Marica Miric from the Croatian Union of Associations of People with Disabilities. Marica, please switch your video on. And the question is, as for the other speakers, what, in terms of the Croatian personal assistance system, what would need to improve to make it more in line with CRPD and to better support independent living? Marica, please go ahead, and thank you.
Thank you very much. Hello to all. It's nice to be here with such a nice company, and I congratulate for this report you presented about independent living. It is very important for our countries and for us, for our advocacy work. In Croatia, as you know, we did have introduced personal assistance in 2006. Until now, we did have 2015 personal assistants and or users. Of them, 187 use personal assistance 8 hours, and all others 4 hours at working day, half of working time in the month. And also it is very important that we finance it through state budget and through European Social Fund. What are challenges for us to be better independent living in Croatia? We need more accessible facilities from home, streets, buildings. And also it is very important to have accessible transport. We did have in some cities, but in some cities didn't. And also it is very important that the rural area are not covered, and the main transport is made by vehicles of organizations of persons with disability. Necessary is additional money for costs of disability, and we analyze, and it is, let me say, on the lower level in the whole Balkan region. Also, we didn't have social dwelling laws, and homes for independently of persons with disabilities are very usual inaccessible, and didn't practice enough universal design. Also, personal mobility is under the question because we did have assistants who transfer person with disability from bed to wheelchair by hand without lift and so on. And we did involve modern technologies very much, but it is necessary to improve it in our in personal life. And also the possibility to be employed is very, very good one. And now the challenge is to have personal assistant on the work. And to combat poverty, it is very, very important to have more of these questions solved. Challenges in the Croatia which can be solved are possibilities are, we are preparing new law on personal assistance, and I hope it will be based on the needs of persons with disabilities, because all other elements of independent living we are respecting on some way. And also we establish working group for the law and have our neighbors from Slovenia to present us how their law is working. And also we are preparing new law on costs of this additional costs of disability, and I will send to Ines to ask her to get some experience from other countries to help us to do it on better way. And also I hope that we will succeed some things which we got as concluding observations and as list of questions for Croatia of Committee of Persons with Disabilities by our new strategy. It will be called new Croatian plan for improving the for equalization of opportunities for persons with disabilities. We are now involved as representative or persons with disabilities, and we hope that it will help us to from 2021 to 2027 to solve a lot of these problems which are still here and which persons with disability in Croatia cope with. Thank you.
Thank you very much, Marica, for sharing this with us. So in Croatia, there is a personal assistance law being drafted as we speak. So obviously, it's an opportunity to have a good law. And Marica mentioned Slovenia. Slovenia is actually the only country in the whole survey where the access to personal assistance was found to be as adequate by our respondents. So, and as ENIL, we are very happy to put people together and to share between us how ways how we can make sure that the new personal assistance legislation in other countries also is also a good one, basically. And we have our last.
Yes, sorry, I just don't mention the institutionalization. That it's only one sentence. That it start very, very good in Croatia, but now we did have problem because it doesn't go on the way how we want, and we need new strategic documents. Thank you.
Thank you, Marica, for adding that. That's very important. I will pass the word to João Varela, to our friend from Portugal, from the Center for Independent Living. Portugal is another country which has some form of personal assistance, also funded to add, co-funded from the European Social Fund, just as it is in Croatia. And João, you will be the last one before we have our break. Go ahead.
Okay, thank you. Hello, everyone. Thank you for having me and having this event. Today is the Human Rights Day, so give me just a minute to celebrate it, or try to. It was adopted 72 years ago in 1948, and here we are today, still fighting for our rights. Changes are happening, though at a certain slower rate than we all wished for. In a day where we are talking about individual liberties, those same liberties keep being violated every day, when many persons with disabilities are trapped in institutions or places where they really don't want to be. According to Article 19 of the Convention on the Rights of Persons with Disabilities, it recognizes the equal right of all persons with disabilities to live independently and be included in the community, with the freedom to choose and control their lives. And it's still not happening, and not in Europe, which we all have as having a really high standards, and we hope we can change that in the near future. Of course, now talking about the question in hand, 2 or 3 changes that should happen in the personal assistance in my country. Well, I will list some problems that are a bit hindered or are a problem completely. So, for example, having the right to personal assistant, since it's just a pilot project, it's not available to everyone fundamentally, which is a big problem. We don't really have a law yet. Having the right to change personal assistant, it could be another difficult thing. Having the right to choose a personal assistant, it happens in some places due to how it's established here. So the pilot project actually is based on the institutions themselves. They are the providers, and some institutions don't really allow people to choose their own personal assistant. Having the right to the correct amount of personal assistance. As of the definition of personal assistant from the General Comment 5, paragraph 16d, point 1, funding for personal assistant must be provided on the basis of personalized criteria and taking into account human rights standards for decent employment. So actually, we don't have we can't have the hours of personal assistant that meets our standards and our needs. Having the right to control to train a personal assistant, so we actually need someone else to train our personal assistants. Having the right to control the service, whether through a contract of a provider or as an employer. We also don't have this. The personal assistant is the service is executed through the institutions, so we don't have direct payments, which is also defined on the General Comment 5, paragraph 16d, point 2. The service must be controlled by the person with disability, meaning that he or she can either contract the service from a variety of providers or act as an employer. We don't have that as well. It goes right through the institutions. So these are the main problems that we are facing here right now. And we hope that in the future law we can we can put an end to them and have a better service. And well, thank you. That's what I really wanted to say about my country.
Thank you very much, Joao, for sharing that. And thank you to all the panelists for sharing some just bits of information from the different countries. Obviously, we could continue this discussion, and we shall do so next year, seeing how we can best exchange about the PA systems and assist each other. Now, let's take a 10-minute break, and then we will give the word to our colleagues from the European Commission and the European Parliament and FRA. I will play a couple of videos during the break for those who want to stay and watch, but otherwise feel free to make a cup of coffee, tea, or just to have a little break. And we will resume in 10 minutes.
With disabilities into institutions is a form of discrimination. Institutionalization leads to segregation and social exclusion and is not compliant with the United Nations Convention on the Rights of Persons with Disabilities. Article 19 of the Convention requires that all persons with disabilities are provided with the right to live independently and to be included in the community. Countries across the European Union benefit from the so-called European Structural and Investment Funds, or in short ESI funds. One of the priority areas supported with the ESI funds is the process of deinstitutionalization. This involves closing down institutions and developing community-based services for persons with disabilities, such as providing them with housing and personal assistance. The problem is that many EU countries use ESI funds to build smaller institutions, instead of ensuring that persons with disabilities can live in regular apartments and houses, alone, with their partners, families or friends, with the support they need. When countries simply replace bigger institutions with smaller facilities accommodating 6, 12, 30 people or more, they are effectively using these funds in ways contrary to the UN Convention on the Rights of Persons with Disabilities and EU laws. They are denying persons with disabilities a chance to decide where, with whom and how they live. Since 2007, disability rights groups have been warning about the misuse of ESI funds. They have been raising awareness about the problem by publishing reports, sending complaints to the European Commission, the European Ombudsman, and even filing a case to the EU General Court in Luxembourg. Their aim is to stop investment of ESI funds into institutions of any size and to ensure that as taxpayers, our money is used to develop genuine community-based services. If you know about any situation where EU funds are used to build or renovate institutions for persons with disabilities, report this to ENIL and get involved. Together, we can make our voices heard and make sure that institutions are closed down rather than modernized or simply replaced. Only then we will be a step closer to making disabilities have the right to live independently and to be included in the community.
Welcome back, everyone. Let's resume here. So for those of you who were able to watch, we showed 3 films, little films, one by ENIL, one by Freaky, a group of activists fighting for personal assistance in Hungary. And the last video was from iLiving, our member in Greece, who are also fighting for personal assistance in their country. I hope you enjoyed that and like those videos. Let's get on with our next part, which is quite important, quite exciting. We have with us next Katarina Ivankovic-Knežević. She is the director at DG Employment, Social Affairs and Inclusion at the European Commission. Katarina is one of the key people responsible for the European Disability Strategy as well, for the upcoming strategy. So Katarina, we're very happy to have you here today, and we're keen to hear from you some reactions to our survey. Also maybe what the European Commission is doing in this regard. And I'm not sure if you had the chance, there were some questions already shared. You're free to reflect on those. If not, don't worry, I will come back to those later. Katarina, the floor is yours.
Yes, thank you so much. I was just looking at the question. So good afternoon to all. I'm happy to be with you today. Do you see me? Do you see me, hear me well?
We can see and hear you well. Go ahead.
Okay, perfect. Perfect. I had lots of connection problems today, I have to say, and I hope I'm not going to get cut off, but nevertheless, so far it has been working really well, and I really hope it will continue so. I believe you opened a very important topic today. Well, you have been opening this topic for quite some time and putting it highly on the agenda. I'm happy to see the examples from the member states. And my special greetings goes to Marica, Marica, I haven't seen you in a really, really long time. And as we have been confined and in this new normal, which I hate, if I may share with you, indeed, it's becoming more and more difficult to meet and to discuss, but nevertheless, let's try to use the best of what we have from the digital world. And some of you know already that this is not a new topic to me. This is something that I was working a lot and fighting a lot in my previous posts, in my previous life before Brussels. And I'm happy to see some movements and some changes being made. And I can also share with all of you who are saying that these changes do not happen fast enough, and that sometimes it's really long time. It takes a long time to establish the good and solid system of the personal assistance. And I remember when I left Croatia almost 2 years ago, and 2 years and 2 months ago, it was the work on the draft law was ongoing, and I hope, I keep my fingers crossed that soon it will be finalized. And I remember my path. So when trying to introduce the personal assistance in the ESF schemes, in the pre-accession schemes, it was in Croatia at the time, less than 500 people had possibility to have personal assistance because the national budget was just too stretched. And I'm happy to see that the number is increasing several times, but still it is largely insufficient. And this is something which most of the member states have the reluctance towards, not only EU member states, in general states have the reluctance because they see it as a huge social spending, while I truly believe that it should be seen as a huge social investment. And until this paradigm is switched and changed, we might be tapping in the dark. But I hope the light is somewhere at the end visible. So thank you, ENIL, for your survey. I have to say I did not read it all. I read the parts, and I read the summary that you sent, and it's always good to know, and it's always great to have some evidence, and we all work on the evidence-based approach. And I congratulate you on your good work. I know that, of course, it still requires some cross-checking, and maybe some things needs to be moved and corrected here and there, but nevertheless, you are showing the pattern, and I believe this is very important. So what do you want me to tell you about the new strategy? Everything, I suppose. And the new strategy starts not from the scratches, it starts from the present strategy in 2010, 2020. We undertook really detailed analysis of what worked and what did not work in the present strategy. What were positive aspects and what were shortcomings, and we are trying to change it, and we are trying to make a difference in the new strategy. New strategy on the rights of the persons with disabilities will be again a 10-year strategy, which I believe is the best thing that we could get, if you ask me personally, and if you ask me as a policymaker, because we see that for some processes it really takes time. But I also don't believe in excuse that some processes take lots of time, because there is no excuse for not acting now, and this is my starting point. In the new strategy, we pay lots of attention to accessibility, and you will see, and we saw it in your, especially in the GRIP video, it was so visible how accessibility is important. And we start from the premises or from the paradigm of independent living. If you also ask me as a policymaker in let's say last 10 years, I believe we focus too much on the institutions, and the whole process of the deinstitutionalization was really driven by trying to address only the problems of respective institution. And therefore, if you had an institution for children or persons with disabilities in XY area, you were trying to focus just around that institution and what to do with people living in that institution. I believe we did not focus enough on all the important aspects of independent living. First of all, securing services that will provide support for living in your own home. Second of all, services that are relevant for living in the community, that facilitate life of persons with disabilities, such as daycare centers or some other social services that are very relevant for the persons with disabilities. And then what I haven't seen that member states have been focusing a lot is on securing sufficient and workforce for persons with disabilities. And we have seen in all the member states for the personal assistants do not, most of the time they do not require any specific skills, which is fine for some kind of assistance, but for some kind of assistance, it is good that they are familiar and trained and upskilled and reskilled and whatever to do with the skills. And this is something that should go hand in hand. And the worst, I think the worst occurrence was that within the different type of institutions that are existing, we should not forget all these other elements of the independent living. And last and the most important one is the right to choose. So if you have, because the Article 19 is quite clear, it mentions the residential environment, it mentions community-based, it mentions in-home, and it mentions the right to choose. And this is where the key is. that whatever is being invested in has all these elements on board, and that indeed you do not create additional layer of smaller but still institutions, but you create the conditions that everyone is really living the way he or she wants. I'm not going to reopen the discussion about some type, because arguments for maintaining some institutions is that some type of disability require additional medical or attention, but I think we can speak about extreme. I believe when we speak about, let's say, mainstream disability, this is where we need to put our additional effort, that services in the community are there. So indeed, what we plan to address in the new strategy is, and you will see it quite soon, because our planning is not, I believe, in less than 3 months. We should see the new strategy, and we have undertook so many consultations, so many rounds of consultations, and you were part of these consultations, and Frank was our rapporteur for the commissioner, and I thank you, Frank, and Ines, you were as well, I believe. So it's really to show that it's important to listen and to be heard. So we are also indeed planning on providing support to the member states on the understanding what does independent living mean and what does inclusion in the community means. Also, we are planning to have initiative relevant to the personal assistance schemes in order to help the member states to facilitate this process. And my very honest opinion is that if there wasn't EU funding, in many member states, the processes would be still at a very low scale, and still we would not have even these services being developed that were supported. Therefore, I see the EU funding as a huge possibility. There has never been more money on the table than it is now, and it has to be used wisely. It has to be used wisely, and it has to be used if we want to speak about independent living, then we need a package. We need a package of what is going to be done, by whom and for whom, and that is very important. Also, we have to pay more attention when it comes to the housing, different housing challenges of the persons with disabilities, related to either energy poverty or related to the renovation needs or to the adaptation needs to maintain just the basic accessibility, if you want to put it in this respect. And also we want to work closely with our colleagues from DG Santé to make sure that good practices relevant for the mental health are in place in order to strengthen the transition from institutional care to patient-centered and community-based services for those that need it. So just my last remark, what is important is that community-based services and services are services of good quality, and that is, I would dare to say, prerequisite for successful implementation of independent living. Thank you.
Thank you very much, Katarina, for your remarks. I have just been making some notes, but there's quite a rich discussion going on here in the chat. Thank you. I think it's important for people to hear what the European Commission is doing in this respect, what the focus is on. I would just like, while we still have you here on camera, there was a question about definitions. Obviously, there is a lot of misunderstanding of what independent living is, also what personal assistance is, and what are the chances that the new disability strategy might actually include some definitions or refer to the definitions in the in the Convention on the Rights of People with Disabilities and in the General Comment, because this is in fact an area that ENIL has worked for many years on, this misunderstanding of the terminology.
Sure. Well, Ines, that's a very tough question, because I've been having recently huge problems and to deal with the number of pages that the new strategy is going to have. And if you ask me, it's really very difficult, because we do have, and Catherine is, I'm sure, very much aware in our better regulation, how many pages can we have. And what we wanted to do in the new strategy is to address each article, UNCRPD article. We wanted to highlight the most important, we call them flagship projects, and in the area of independent living, we do have a flagship, which is this communication on the independent living, where all the definitions are going to be put in place. But we don't simply have a space in the strategy to go so deeply into one of the topics. So no, you will not see it, but you will see where we are taking the independent living, and it is extremely clear, and it will be very visible for all of you and for all of you who are dealing with the DI issue. Do I have some other questions? I see Frank asked.
Well, if I can take one more question, Katarina, because you mentioned the role of EU funding as well. Obviously, we know it can have a major positive role as well. But there is a question from Malta. There is a project in Malta called REACH project, which is using EU.
Yes. I know, and I read it. It was in Q. It was yes. in Q&As, and the question is about financing smaller institutions.
Well, I think the whole project, because in fact, ENIL has been contacted about that project, and we have given our negative opinion. So has the European Disability Forum, as far as I know. The question is maybe what the people from the national level, from Malta in this case, what they can do in terms of either notifying the Commission or anything.
Yes, absolutely. It's always the good way, and you know that we have our geo units that are dealing with the different member states, and also it could be the letter assigned to them, and then it will reach us anyhow. But the issue is, and you know that in some member states we are pushing very much the national authorities to secure services in the community and to really implement UNCRPD Article 19 properly. It's not an easy process. I have to tell you, you know it quite well. It takes time. It's in my understanding, it's very difficult to get it. Why it is so difficult to employ additional people as a personal assistant, because you are solving two problems. You are solving the unemployment, and you are solving inclusion of persons with disabilities in the society. So if I would be the policymaker, I would see it as a win-win situation, because it is a win-win situation, and therefore it is very difficult for me to understand why some of them are open for the different options. But nevertheless, we see small successes. We see that it's moving forward, and that's the most important. And what we want to achieve with our future communication on independent living, that it's really, because you know as well as I believe all of our 36 participants, the only place where Article 19 should be interpreted is the UN Committee. And we have seen the different recommendations for the different member states. For example, for one member state, the recommendation is put in place the institutional framework. And they don't say anything about the institutional framework. Is it right? Is it not right? So is it right to have 20 people living together? Is it in line, or is it not in line? So therefore, I believe we still have a long way to go in order to understand what is proper implementation of the Article 19. But we should not support anything that does not have all these different elements of the independent living. So in-home support, community-based support, and sufficient workforce. And right to choose.
Thank you, Katarina. Maybe this is actually a good point to bring in Sergio. And actually, we have just yesterday released a study on the use of EU funds in the 2014 to 2020 period. And in that study, we have actually put together all the CRPD committee recommendations on funding. So from ENIL's point of view, the jurisprudence is quite clear, and also the general comments. So we will make sure to send it also to you, of course. And Katarina, if you agree, I would bring in Sergio now, and we might come back to some other questions.
Sure. And I can also just only say that I read Nadia's comment. Indeed, Nadia, you are absolutely right, and that's why it is important to have the other services that people can choose. That's the key point. Okay, so I go off now.
Thank you so much. Yes, and we could talk forever, but I do want to bring Sergio in here. Sergio works. Sorry, I just cannot pronounce the last name. Ares, maybe. He works with MEP Marisa Matias. So some reflections from your and Sergio would be very welcome. Please go ahead.
Okay, thank you very much. I hope you are listening okay and seeing also. Okay, so thank you. I bring the excuses of Marisa, but as you, some of you might know, she's running for the presidency of the Republic in Portugal, and therefore the elections are in January, and she's really having a busy moment now. Nevertheless, thank you for the invitation, and I will try to react a little bit. Thank you for the study, which is actually, as you said, Ines, is quite complementing, or the other way around, the other study that we promoted together on the use and misuse of the structural funds on independent living. I think that they both complement themselves very much. So it's even more important to see the results of the survey now all together. I will make some comments around all the things that were said. I mean, in our country, in Portugal, we are drafting the national strategy. We are on public consultation at the moment. We are worried about some of the issues in the strategy. They were mentioned already by several people because it happens in different countries. Just some comments on some of the issues that the survey brings. Put it in highlights. For instance, on DI, I mean, it's clear that it's not happening, and it's not happening everywhere. It's a minority of countries mentioning that they have this strategy, and so we are not in the good way, clearly, as it was mentioned by so many people. But also the most worrying thing is that still we have 22 countries mentioning that the money is being mainly directed to institutionalization. So it's even more worry. On personalized assistance, I think that we have here also problem of concept and also of definition, because when sometimes I ask in my country if persons are receiving personalized assistance, even when they are institutions, people say they have. I mean, just by the fact that they have the normal services of the institution, they call themselves, they call it as it was personalized. So sometimes even when, if you have 77% of people saying there is personalized assistance requiring improvement, is already a sign. But sometimes I think that even when people say they have personalized assistance, this is based on the culture of the country. So I imagine João could enhance this very much. But I imagine that if you ask directly some people in institutions, they would say they have personalized assistance. They have some people taking care of them, so they can consider that personalized sometimes. And clearly in institutions in general, we don't have personalized assistance as we defined it. Complaints are one of the things that worries the most, because they are very difficult to do. I mean, particularly when you are under a system of public help from the state, or that then delegates in institutions some of them organized by the civil society, and complaining is quite risky for some of the persons. Let's be clear about this. People don't complain because they are afraid of the consequences of those complaints. So having the liberty to complain is something that we should also focus. The salaries paid in this sector are also a worry, and particularly when we speak about in our country we use the designation of informal carers, like João Varela was mentioning, we have now the pilot projects, which are not exactly going in the direction, or at least totally in the direction that we wanted. So we are totally subscribing, and we will make echo of your recommendations. They are in line with what we also defend, particularly on the clear European targets and monitoring. Let me tell you that it's something not very nice, but this morning we had a trilogue. We thought it was the last trilogue on ESF, and yeah, it was the last trilogue on this presidency, but we didn't reach an agreement. And mainly, and I'm bringing this issue here because mainly the conflict between the Parliament and the Council is on the thematic concentration. So exactly on defining earmarks and clear targets for specific issues. And so we have here a problem of I don't know, let me say it like this, a political will from the Council and the member states on defining and committing with clear targets. And so this is still a problem that we have to when we want to have clear targets, and then the member states are not able to commit themselves with a bunch of arguments that really don't apply. Finally, 2 or 3 things that already reacting to the Commission intervention. If evidence-based is good and is crucial for our intervention, then we should take it seriously and act accordingly. And for instance, let me underline the study on the misuse of structural funds. If we are clear that in some member states, in some cases and in some regions, we are clearly misusing structural funds, particularly against the rights of persons with disabilities, we should act according to this evidence-based. Concerning the new strategy, I mean, we are in the Parliament quite worried that the delay on having this strategy is taking so long. As you know, we try to do our best to be as fast as possible on having our position on the strategy, which is quite strong, particularly on independent living, and not only. So we would like as much as possible to see this strategy, particularly because we have a worry already quite strong on the COVID consequences. And COVID brought us also lots of lessons concerning institutionalization and why we really need urgently to proceed on DI. The right to choose, I would say, as the Commission said, if we don't have the right to choose, there is no independent living at all. So the right to choose is clearly the main focus of independent living. So if people have not the freedom to choose the services and the persons that can give them the services, we have here a problem to comply with our orientations. Then finally, maintaining institutions. Katrina was not touching this issue because it is the tricky one. Always, it is the tricky one in my country, but it's the tricky one in everywhere, because there's always a good reason for keeping institutions going on. So I think it's a common fight that we should try to continue to tackle, trying to make clear that we don't need them. We need a different approach, and it is possible. And speaking about money, yeah, money sometimes doesn't change a culture, the social culture of a country, in changing the paradigm of intervention, but it helps also. Without money, for sure, particularly without European money, we will not get it. This initiative from the European Commission to facilitate personal assistance and bringing some money and some resources will for sure help us on the ground trying to make a difference. But let's be sure that I heard something that I cannot agree, but it was said that there's a lot of money going around, and we should make sure that this money will be well spent. But in reality, we have lots of special money going around on the COVID consequences. But for instance, the cohesion funds are diminished. ESF will be diminished in this period. So let's not confund ourselves, because the resources on ESF, particularly, for instance, and in other funds, are less than in the previous period. So and on the strategy, I would recall on the urgency to have the European strategy as fast as possible. Also because, as I've heard, not only my country, but others are preparing their own national strategies, and some of them are probably not taking in consideration the strategy that we are building, and even the recommendations from the Parliament. I mean, we need the European strategy to give a kind of a backup to the national strategy. If not, we can end up with lots of differences between the member states concerning specific issues, particularly this one on independent living. That's all for the moment. Thank you.
Thank you very much, Sergio. You've touched some really key points, and thank you for bringing also the point of the impact of the COVID pandemic, but also the funding that's been available to the member states into the discussion, and the effect this might have on funding available for personal assistance or for other community-based services. Thank you for that. Let's go to our last panelist in this session, Robert Jan Uhl from the Fundamental Rights Agency, who can tell us a little bit about what some reactions of FRA on the survey, but also maybe a little bit about your plans. FRA has done a lot of work on independent living in the past. It has been one of its focus areas. It'd be interesting to find out also about your plans in the future, but how you can support also this work on access to personal assistance. So please go ahead.
Thank you very much, and thanks very much for inviting us. Of course, this is indeed a topic that the agency has done a lot of work on, a lot of research on in the past. Yeah, just to start, I think just an overall kind of reaction is that it is striking that the situation with respect to DI hasn't changed more or more positively. I think it proves once again that human rights conventions do not implement themselves, as we all know. So a lot more hard work from people like ourselves will be needed to turn these commitments and these obligations into a reality on the ground. I've just pasted in the chat section also a link to the FRA work in this area for those who are interested. And I also just want to say that, of course, we've monitored the situation with respect to COVID and the impact of the various measures that have been taken to fight the COVID-19 pandemic in our COVID reports, which you can also find on our website. And I think it's fair to say that the pandemic has really starkly demonstrated the weakness of the systems that we use to assist persons with disabilities to achieve independent living. So I thought maybe it would be interesting just to talk a little bit about some of the to sort of recall the FRA research findings, to see what could be done to improve the situation, because I think that that's really the big takeaway from the research that you've done, that there's simply a need for more very practical action on the ground, both in legislative terms, but also in terms of simple, actual budgeting, national action plans, and so on, things that are very practical. So just to recall some of the things that we found in our research and kind of compare notes a little bit. So I think a few things, I would say a few things that are needed to improve the situation from what we've seen in our research are obviously a commitment to deinstitutionalization. That's absolutely vital at the local level and the national level. Clearly, external pressure from the media, for example, is vital. Pressure from other parts, monitoring reports like this one, of course, that you've done, or from the EU itself, can also be very important to create political will and momentum. And of course, we mustn't forget, persons with disabilities themselves as self-advocates for DI. Those are some very important ways we can, some important actors that can improve the situation. Of course, we've seen a lot of lacking commitment also from the research you've just outlined. There's a lack of funding, or it's difficult to access it. There are some vested interests that want to maintain the status quo and keep these large institutions in place. And of course, as we've mentioned before in our research, the fact that a lot of people with disabilities are still deprived of legal capacity, which of course can then result in people remaining in institutions longer than they have to because they don't have the legal capacity to get out of it. I think it's also very important to talk about the attitudes that, how to change attitudes and the importance of changing attitudes towards persons with disabilities. There are, of course, many strongly embedded beliefs that people with disabilities should be looked after, cared for, and so on. And here we often saw so what we would call a virtuous cycle. So if people with disabilities become more visibility in the communities are more welcoming, and then that makes the transition process a lot easier. And the same is true of positive representations of people with disabilities in the media. And then another important thing to note, of course, is the importance of cooperation to achieve DI, so between different sectors, communities, and between different levels of governance, so from the national to the local. And I won't go into it too much, but of course we've captured a number of good examples in our reporting. As my daughter walks in, oops, I think, yep, there we go. Yeah, hello to everyone. Yeah, she'd like to listen to some songs, but I'm afraid that's not going to be possible. Oh, there we go. So there we are. So bye, Charlotte. I apologize for that. Yeah, so just to get back to what I was saying, we've seen a lot of good examples of cooperation, but there are still a lot of gaps. A lot of practitioners, particularly at the local level, often feel excluded from local decision-making processes, and there are also a lot of problems with regard to just the practical organization of the institutionalization. So when we asked participants in our studies to rate the importance of all the barriers, I think the key thing that came out was the lack of suitable housing and a lack of community-based services. Those are the two things that really always jump out. And I also wanted to note the importance of guidance on how to implement DI. So there was a lot of frustration on the part of practitioners at the local level at the lack of useful guidance from national policymakers. They asked for clarification on things, and then they didn't get it. And there was also talk about how a lot of a lack of information about how and when DI would take place created confusion among both the people with disabilities and their families. And so there are, I think, a lot of good practices out there. There are a lot of pilot projects, some of which have been mentioned by the previous speakers. a lot of learning exchanges that have taught the various actors on how to engage and how to implement DI, but there's still clearly a lot of work to be done. I think as an agency, in terms of our plans, we continue to be a very active member of the EU CRPD framework. We will continue to promote the findings and opinions in our DI reports. We've been doing that over the last few years in many countries. We will continue to follow the trends in DI in the annual fundamental rights report, where we will also mention promising practices that we come across, but not just promising practices, obviously, also more problematical ones. We've also started working with national monitoring bodies on the use of human rights indicators at the national level. So looking at how the monitoring bodies can set up or help the other parts of the government in their countries set up human rights indicators to see where we're at. And obviously DI is going to play a crucial role in that as well. The general comment was mentioned, and of course it's very clear about what we're targeting. So we will definitely include the targets and the benchmarks that are included in that as a very important part of the work on setting up national indicators. I think ideally we would like to have kind of EU-wide indicators that can be compared with each other to make it clear where each of the countries, where every country is at. But I think at the moment, the work is in some places is just starting on creating these indicators, but I think it would be very important to measure progress and to see where the deficits still are, and to use a human rights-based focus to ensure that it's very clear, how those indicators should be set. So that's some of the work we'll be doing, and I'm happy to to talk a little bit more about this if people have questions. So thank you very much, and apologies for the brief interruption by my daughter.
Thank you, Robert, and absolutely no problem. Children always come at the right time, but it was lovely to meet her as well. So thank you for that. I think if I take something from your intervention here, indeed, we would very much welcome the involvement of the national human rights institutions more in the process of deinstitutionalization, but also in terms of monitoring of how funds are used, how personal assistance is provided, because they do not play that role as of yet in that many countries. So the other points, and this is where I can go briefly over the chat discussion. There was a point about training. The Commission has mentioned, Katarina has mentioned, I believe, training. You are talking about creating indicators. So the role of disabled people in providing training, but also in any work which relates to disabled people and the rights of disabled people is very important. Also, again, we come to the confusion between the various concepts. We've had a point in the discussion that we must distinguish between personal assistance and professional support. It's important that disabled people are in control of their personal assistance, that they're the ones that are training them, that personal assistance is not a profession, somebody who's trained by others and told what to do. It's important for disabled people to be in charge. There was a point about the importance, of course, of housing, which you also mentioned, and which Katarina has mentioned. We will see to what extent it will be tackled, addressed in the strategy. Unfortunately, it seems we will not have the definitions in the strategy itself, which is a shame. So that misunderstanding might continue. Since we have just a couple of minutes, I wonder if any one of the panelists would like to come in at this point before I hand over to Nadia for some closing remarks. please just switch your video on. Sergio, would you like to say something? You have your video on, or if anybody else would like to come in, please feel free.
Sorry, I had my video on just because I forgot it. But I take the opportunity to say thank you very much, and congratulations for all your work. Thank you.
Thank you for joining us, Sergio. So if not, I will hand over to Nadia to perhaps summarize for us what she thought were some of the key takeaways from today's discussion. Nadia, please go ahead.
Okay, thank you, Ines, for giving me the floor. Thank you to all persons who participate, their testimonies with us, but also the Commission FRA and the Parliament. We saw that a lot of common barriers still exist in a lot of countries, so the concerns are still there. We saw also some good practices like supported decision making was available and peer support also. So those two we should really take them with us in the future and highlight it also a little bit more about personal centered services also. We saw that common barriers then in a lot of countries people still cannot choose their own PAs, they are not informed enough, and then it's the whole discussion of being informed and what is needed for that. And also the number of PAs a person can have depend over is different from one country to another, and there is not enough funding for it. And also that in a lot of countries there are no trainings and people don't know how to manage PA. So that are barriers that we should try to find a common solution for it. And there is also a danger that has been mentioned that PA is mixed with care and exclude some people and limit the access to other services. So that's something that we should take in consideration to fight against this kind of discrimination. We also get the testimony from Norway, where the legislation has already an DI strategy, but that so the law is adapted, but that in reality, it doesn't change much. So there are a lot of barriers, which shows us that legislation alone is not enough. There must be awareness raising and also a paradigm shift within the society, and informing people about their rights and what it is. A DI strategy is something that we still need to work on. And in other countries also personal assistance is provided by institutions without working on an DI strategy themselves. So there is no transition. So they keep the institution and they keep personal assistance services on the same way, on the same time. And it's not emancipating people with disabilities to be actively involved in the society. So what would help us? I think we heard about one of the recommendations that came out of the survey is to have to adapt a comprehensive and new DI strategy with the participation of personal disabilities themselves on all levels, not informing them, not just taking them as beneficiary, but really taking them as potential stakeholders, not only in the beginning, not doing the realization itself, but also in the monitoring and controlling and evaluation phase afterwards. Even if the European Union can say that it's not their competence, but they can have a leader role in ensuring that the PA's personal assistance legislation is funded properly, and that there is a guarantee in every country that persons could hire them instead of still continuing funding institution directly, that there is a transfer of funding, but at the same time we need to have alternative services who can pick up that support for a person with disability, like we saw in Sweden, that they have that support guarantee. And also we hear, sadly enough, that terminology will not be taken into the new disability strategy where we had big hopes. So then it's back up to us to lobby again. I still remember that ENIL organized in 2014 a side event during the CRPD session in Geneva, and the title was Stop Hijacking Our Terminology. Look, we had the general comment after it in 2017, and we had an evaluation of the strategy after it. And sadly enough, we still didn't manage to go through it and to be able, I need to make it a priority, because without a common understanding about what it is about, independent living, what it is about, putting people out of institution, what it is about, community-based services, I don't think you leave too much space for interpretation, so it will not really put in favor the rights of the human right of persons with disabilities to be part of the society and live really independently. So I think we have a lot of trainings to do. We still have a lot of awareness raising, but we should see now how more activists we need to collect to achieve this, because we saw how many barriers we have. So the civil society should join forces, but also we need to see how more impact we can have. And the parliament can support us with this. And then we hope that within the council, through the social pillar, but also within the commission, they will take this on into consideration. And now, as there will be a revision of the European Union by the CRPD committee in the next future, it is really something that we should take with us. Because as long as we are not clear about what we want by person assistance, what we want by community-based services, what we want about all those terms that have such a crucial importance in our daily life, we will never achieve our target, and we will be discriminated, and we will be still blocked in institutions, blocked in segregations, blocked in separation, and that is something that is not aligned with independent living, and it's really, yeah, it's an harassment of our basic human rights. I give the floor back to you, Ines.
Thank you. Thank you very much, Nadia, for this good summary of the points today. And just before we close, I would like to thank our interpreters, Brigitte and Ferdinand, and also our captioner, Norma. And thank you very much to all the panelists, to all the speakers, to all the participants today for great also discussion. As we said, some of the country sheets from the Independent Living Survey are already online. We will keep adding more. Please be in touch. And this is our last event for the year. So we hope to see you next year, and have great holidays, as much as you can, of course, with this pandemic. But thank you so much to everyone, and goodbye.
Thank you.
Thank you.